Hi again, everybody. Sorry about before. It must be my internet or something going on my end because apparently you could see Suvir from Harley Street Fertility Clinic. So in a second, we're going to try and reconnect. So please bear with us whilst we do so. And then we're going to talk about the all-important egg sharing. So let me just join him now. Fingers crossed. Let's see. Please could someone tell me if you can see him because just before... There we go. Good
There we
evening.
go. Much better. Good evening, Eloise.
I'm so sorry. I must have had some tech thing going on because apparently everyone could see and hear you and I just could see myself.
That's okay. I couldn't hear anything that went joined,
Okay,
but so don't worry about it. These things happen. How are
absolutely.
you?
I'm very well, thanks. How are you tonight?
Not too bad, thank you. Not too bad.
Good, good. So briefly, when we were trying to connect before, I was just introducing Harley Street Fertility Clinic as one of our leading fertility expert partners. You have the most stunning clinic in central London. And tonight we're going to be talking about egg sharing, which is a fascinating program or topic I didn't know much about until you recently wrote a fantastic article, which is on our website. Everyone should go and read it. The link is in the bio. And so please tell us more.
Okay, well, thank you very much for the introduction. It's a pleasure to join, as always. And we are quite lucky to have a lovely place to work. It's been a bit different with the lockdown, but it's a wonderful old family home. And I can't imagine what it was like in the old days when it was actually a house. But anyway, enough about reminiscing about old days. So egg sharing. Egg sharing is interesting. I thought it might be useful to give a bit of history as to actually how this came about. So egg sharing is an option for people who are looking into egg donation. So back in the day when the HFEA were first looking at the option of egg donation where one lady donates her eggs for someone else to use because that person maybe doesn't have their own eggs or can't use them, or whatever. There are many reasons that might be the case. And when they first started this, the HFEA were very insistent that they wanted it to be done only for altruistic reasons. They didn't want it to become a commercial exercise where people are basically purchasing eggs or other people are selling their eggs. They were very insistent that, look, it should be done for the right reasons. And we agree with this. I think it's very important that it is done for the right reasons. And so when they started it, they said that there should be no reimbursement or payment for donors. This was now, I think it's a couple of decades ago, so it's a long time ago. And so at the beginning, there were very few cycles of egg donation performed because donors, so egg donors, have to go through quite a lot. So to donate your eggs, it's not quite as straightforward as donating blood or donating sperm. It's quite involved. And I'll talk through that in a moment. But so there wasn't much uptake from donors. And so egg recipients were struggling to find suitable donors. And you had to often bring your own donor. You had to find someone you knew. Or ask around and hopefully someone would volunteer, but it was very, very difficult to find an egg donor. So then a clinic actually came up with the idea of saying, look, we have young couples who sometimes can't access fertility treatment for one reason or another. Maybe they don't have sufficient funds or they've been refused it on the NHS. But actually the lady is quite fertile. There might be a problem with the man, or it might be that there's a physical problem. Say the fallopian tubes are blocked, and for IVF, you don't need fallopian tubes. So in those circumstances, they're saying, well, because there's nothing wrong with the lady, why couldn't she donate some of her eggs to help someone and at the same time have her own treatment? So the cost of the work being done is sort of covered by the recipient. And the donor gets to, one, help someone else, and have her own treatment. So you really get two birds with one stone. It's a fantastic idea, whoever had it back in the day.
But so it gets her treatment for free?
Yes. So her treatment is being subsidized by the recipient. So her treatment these days is completely free of charge. And so, and it's nice because ovarian stimulation is not easy to go through. So the first half of IVF. And like I said, you can hopefully get two people pregnant with one round of treatment. So it's win-win on all sides. And for the clinic, it means that you're able to find potential donors for recipients sooner. So that's the sort of backstory on it.
And
Now,
how long has it been running for?
So this was licensed in just around the turn of the millennium. So about 2001 or 2002 was when they first introduced this idea of egg sharing. And so now there've been thousands of cycles of it, and it's a very good option. And then if you look at what donors have to go through, the reason that not many people come forward is, so an egg donor needs to essentially go through the first half of IVF to collect her eggs. So she goes through ovarian stimulation, so that's about 10 days of injections, and then she goes through the actual egg collection. And during that sort of 2-week period, she has to come to the clinic every couple of days. So it's quite a lot of work and commitment. And so actually people who do go through it are usually doing it for the right reasons. Now, if they need treatment themselves, they're obviously quite motivated to go through this process. And you might wonder, okay, how do we make sure that it's done fairly to patients? So egg sharing arrangements are usually set out. Typically, we try and set it out in favor of the donor. And they're split. So, when, let's say a donor produces 20 eggs, to make the maths easy, she would share half of her eggs with an anonymous recipient. So 10 would go to the recipient and 10 would go to the donor. If the donor produces an odd number, we typically give the extra one to the donor, just to say thank you, because it's the right thing to do. And if the donor is not producing enough eggs, then we typically talk to the donor and end up giving the donor the eggs, and she has her own treatment, and we find another donor for the recipient. Because they're going through, they're doing something quite wonderful, really. And it's not right for everyone, but some people are really quite keen to do it, and because they feel really good about helping someone else while they help themselves.
I've got so many questions popping into my head, and anyone who's joining who wants to ask, please do ask Suvir. My first question is, how long does the process take, and do they meet each other?
It's a very good question. So the short answer is it takes about 2 months. But there's a caveat to that. So first of all, they go through an assessment process. We have to make sure that the couple or the young lady who's donating their eggs is suitable, one, to be a donor, and that doing so is the right thing for her own treatment as well as the donation. So we do a proper checkup. So, we do a couple of scans and blood tests to make sure that her fertility is good and it's good enough to be a donor. And then we get her ready for treatment. So that can essentially, the assessment takes about a month from start to finish, because there's a couple of genetic tests that we do that take a bit longer to get results back on. And then the following cycle, essentially, she could start her treatment. And these days you have two options. You might be matched with a recipient, or you might actually end up donating the other half of your eggs to be frozen, and then they get used later by a recipient. And the other question you had was about anonymity. So they don't ever meet. So donation in this country is anonymous, or is what I'd call pseudo-anonymous. So during donation, they never meet. In fact, we don't share any identifying information about the donor or the recipient with either party. We do let both parties know the outcome. So the donor does get to find out the outcome of her donation, whether any kids were born, because you want to know how it did. And they always want to know how many children they have. Did they have one or two? Did they have a boy or a girl? So they do get that information, which is really nice. But beyond that, they get nothing identifying.
Would they ever bump into each other in the clinic without realizing?
We're quite sneaky about scheduling our appointments. So we tend to do sort of donors in the morning and recipients later.
Right.
So,
okay.
There's all kinds of tactics that we have to keep them apart.
Yeah.
Or we end up bringing them on alternate days so they don't really coincide. The one tricky day is always, well, it used to be, these days we tend to work mostly with frozen eggs. So we tend to freeze the donor's eggs and then use them later for a recipient. So that problem doesn't occur as often. But a few years ago when we did a lot of fresh donation, the tricky day would always be egg collection, especially for egg sharing couples, because both the partners have to provide sperm. It's got to be done at the same time.
Yes.
And it can't be done on a different day or something else. So you'd always have to be very careful about, booking the donor in typically first thing, and then, booking the recipient's partner in a bit later in the day so that they don't really meet.
Mm-hmm. And someone has just asked, what is the kind of normal cost for a recipient?
So for a recipient, it can vary quite significantly. Most clinics in the UK or in London will charge somewhere between, well, they'll say it'll be between £6,000 and £10,000 for the cycle. But then once you add in all the preparation and all of this sort of the workup for treatment, you're looking at about £8,000 to £12,000 for a round of egg donation.
Okay.
But coming back to the anonymity, I think because a lot of people will read, if you look on the HFEA's website, for example, who are the regulator of fertility treatment, children who are born from donation can find out the identity of the donor once they reach the age of 18. And so it's not, it's up to the parents, really, to tell the children first that they're born from donation. And then if the children want to know at that point, they can find out.
A bit like general egg or sperm donation in the UK.
Yeah, it's exactly the same.
Yeah. And how this, I don't necessarily need a percentage, but how many of the cycles that you do at Harley Street Fertility Clinic would you say go down this route?
So out of all of the egg donation we do, we probably see, it varies year on year. In the last year, because of the pandemic, actually, we've seen more egg sharers come forward than altruistic donors. So altruistic donors are the people who donate just to donate. They're not having treatment for themselves. But we have seen many more egg sharers come forward. So we've seen about 60% of our donation cycles be egg sharing cycles in the last year.
And just thinking about or talking about the matching process, do the patients get to, the recipients, do they get to choose, you know, eye color, characteristics, all sorts of things that people might generally search for when they're looking for an egg or sperm donor?
Yes, absolutely. So they get, I mean, we treat, you know, egg share donors are treated exactly the same as altruistic donors. So we would provide a recipient, potential recipient, with a full profile of the donor, so including physical characteristics and social characteristics, their interests, their hobbies. Donors also complete a pen portrait of themselves, you know, as to why they're doing the donation, what sort of made them come forward. And it tells the person a little bit about themselves. And they do also put in a goodwill message for the child specifically, which is lovely. And if you read some of those reasons as to why people donate, they touch your heart.
I can imagine. What was I going to ask you? I think, was it about about assessments? What are the assessments that the egg donors go through before the matching process or before they're able to be a donor?
So egg share donors or egg donors go through the same assessment process. The basic criteria are that they must be under 35, or, you know, they must not have had their 36th birthday. And that's at the time of egg collection. So that's when the eggs are retrieved. They need to have a good fertility. So typically to assess that, we will do an ultrasound scan to determine their antral follicle count, and we'll also measure their AMH and hormone profile to make sure that the hormone profile is normal and that the AMH is at a good level, so it's sufficient to donate and treat themselves. And then the other part that we do is the standard sort of genetic and infectious disease screening. So we make sure there are no major inheritable or transmissible conditions. And we also ask them to see a counselor and it's a specialist fertility counselor for a session of implications counseling, so that they understand the full implications of what they're doing, and also, you know, what the legal position is about anonymity and everything, so that they look at things on the big picture, really.
Sorry, just jumping back, because someone's asked about the cost. The price that the general sort of ballpark you gave, was that including the eggs as well?
Yes, that would be including, you know, so it's generally, if you think about it, it's sort of like having a cycle of IVF plus all the screening for the donor.
Right, yeah. It doesn't sound too bad actually in cost, if you compared to what it might be, you know, to do it separately. What about, sorry, one other question is, are these options open to US residents if someone wouldn't mind traveling?
Yeah, it's not limited to anyone who's resident in the UK. You could come to the UK for treatment. And often we do actually get people, particularly from certain countries in Europe where egg donation isn't allowed, travel to the UK to get this treatment. And we do get people from the Middle East as well sometimes who come for this.
Anyone from America?
America, they tend to stay over there for their egg donation. The legal situation is slightly different, but it is a lot cheaper here than it is in the States. So at some point, people will start to come this way, but not yet.
Someone just said
I
Canada.
think the difference is in the US, it is much more of a sort of commercial operation because donors can be almost essentially paid depending on the state.
Yeah. Yeah.
So, you can pay for a Harvard graduate or what have you.
And sorry, another question about cost from someone. Is the price one egg donated? So does that cover one round? Like if it was not successful, what would happen?
It's a good question. And patients always ask, is it just one round? Would I have to pay again if I go through it and it's not successful? Yeah. The answer is unfortunately not that straightforward. So if the first round goes very well, typically you'll have extra embryos left over. And if the first transfer isn't successful, you could come back and use some of the embryos that were extra that would have been frozen. And the cost to use those is significantly less. You're looking at about £2,000 or £3,000 to undergo a frozen embryo transfer. But if you use up all of the embryos, then you would need to look at the donation cycle again.
And I presume that would be with a different donor?
Yes, typically, but not always. We've had it where a couple were unfortunate once with one donor. They tried again with the same donor and got pregnant. I mean, it is sometimes much like IVF when you're doing it with your own eggs. It's not always successful, but you can try again, and sometimes it is.
And just thinking about other sort of situations, if someone was to be successful and had a child and then they wanted to try for a sibling, what would happen in that situation if they didn't have any further embryos?
It's a great question. We had it happened quite recently where someone wanted a sibling. They'd finished all the embryos, and we asked the donor to come back, and she agreed to donate again. And actually, in such situations, you can waive the standard age requirements if you want to.
Yeah.
Because in this instance, actually, the donor was 37 or almost 38. And she agreed to come back, but we had to tell the recipient, look, this is not the normal practice, and as long as you're okay with it, and she did. They were quite happy. So you can get siblings if you wish.
Good. Okay, that's interesting to know. Thank you. And then someone has also asked, what is the success rate for this?
Great question, and it's got a great answer. It's the best success rate you can ever hope for in IVF, because if you think about it, one of the most important factors in success rates is the quality of the eggs. And in this case, you're taking eggs from someone who is quite fertile. So it's essentially a best case scenario. So you're looking at typically a live birth rate of about 50%.
Wow, okay.
So it's a very good treatment option. Egg donation, for that reason, is a very good treatment option overall. But obviously it comes with the drawback. It's a significant step of not using your own eggs.
And then with your own eggs, I mean, obviously it depends on age, but you're looking at highest of what, 25%, depending on age?
Highest of about 40% these days for a live birth rate, typically. Okay. 40 plus, actually. It's creeping up, which is nice to see.
It's risen since I had IVF, that's for sure.
Yes, it must. Yeah, it's the curve looks really nice when you look at it. So I think we haven't got live birth data yet, but our clinical pregnancy rate last year in women under 35 was 64%. So it's going in the right direction.
And what would you say are the advantages of doing this, egg sharing versus standard egg donation?
Twofold, really. One is you have no questions about whether the person is donating for the right reason. You know that they're struggling to have children, but they're also taking that opportunity to help someone else while they can access treatment. And so, there are some circumstances where donors drop out of treatment, and in egg sharing, that is very, very rare because they're committed to that treatment themselves.
Yeah.
And they're really, the donation is very genuine in that the couple want both people to succeed. And so I think it's always done for the right reason.
I think that, I mean, it sums it up, doesn't it? The story you just told about the sibling, the fact that they came back, you don't necessarily, obviously that depends on the person completely, but I've heard stories of, sperm banks, for example, and probably egg banks too, where people have decided maybe later down the line they would like to try for a sibling, and that donor is no longer donating, and so it's very hard to hear for the family at a later stage.
And I think it's only, when you're in those shoes, when you know what it's like to try and be a parent, and then once you are a parent, you really strongly empathize for the others who are in the same boat. That's why I think it's a really lovely treatment.
Yeah. And how has COVID affected things in terms of, how many cycles you're doing for egg sharing, and as you mentioned, the demand for egg donors and how many there are?
So it's a good question because COVID's impacted clinics in numerous ways.
Yeah.
We have actually, so last year, around the time of that first lockdown, everything stopped. That was the first time in the history of licensed fertility treatment that everything stopped. After that, clinics were allowed to reopen, and we've stayed open. And we've seen a mixed bag. So we've seen couples who've sort of said, no, look, I'm going to put it on hold. I'm not sure with the pandemic. I'm going to just wait. Then we've seen other couples who are saying, well, I'm at home. I'm not doing anything else. I might as well have treatment now. I've got free time. I've been furloughed, or I'm working from home and have more flexibility. So we have seen, for us, it's been a balance. We've actually seen a slight uptick in our treatments, particularly in egg freezing and embryo freezing. We've seen an increase. Egg donation, we've seen it stay quite consistent, but we've seen a drop in the number of altruistic donors who've been coming forward in the past year. But having said that, we've seen, like I said, an increase in the egg sharing numbers. We have another option, which I'll mention. I'm not sure it's directly relevant, but we also let people freeze and share their eggs. So sometimes, young ladies wish to freeze eggs for themselves, but again, accessing that treatment can be prohibitive in terms of cost. So they essentially go through the same thing, whereby they freeze half the eggs for themselves and they donate the other half. And so we've seen quite a large uptake in that in the last year. That's been one of the strongest changes we've seen.
Fascinating. Because I guess it's been nearly was it last week or the week before, a year since the first lockdown?
Yes, it was just the past week. We had a minute. I can't believe it's been a year.
I know. So if in terms of other clinics doing it, is it a regular thing that most clinics offer, or is it something that you guys are kind of pioneering, I guess?
We can't take credit for being the pioneers. We're quite close to the clinic who pioneered it, but so not all clinics do egg donation. A lot of clinics will send patients abroad, which is unfortunate, especially these days. That's even harder. But there are quite a few clinics who offer egg donation in the UK, and of those, I'd say at least 50% will do egg sharing as well. So you should be able to find a clinic that offers this as a treatment option.
I've had many readers come to me, saying I'm looking into egg donation. It's quite difficult in the UK. I've tried a few clinics, and unless I want to go abroad, it's not really an option for me. Who I've said speak to Harley Street Fertility Clinic. So it's interesting to know what these different options look like and who they might help. I guess that's another question. Who is this right for? Who normally has this treatment?
So, like I said earlier, we treat egg share donors exactly the same as altruistic egg donors. So anyone who's looking into having egg donation treatment, so they've been told, for example, they've got premature infertility, or they have a low ovarian reserve, so the chance of success with their own eggs would be low, or someone who's born without ovaries as well. This might be relevant. Or there might be people who have significant genetic issues that they don't wish to pass on. So again, this might be relevant for them.
Okay, interesting. Thank you. Last question, unless anyone has any more. Is the success rate different for frozen eggs?
Yes and no. So the short answer is no these days, but the longer answer is you have to take into account the fact that you're using frozen eggs. So these days, when we freeze and thaw eggs, the survival rate is just over 90% or thereabouts at a good clinic. And so as long as you cater for that, the fact that you're going to lose an egg potentially, or 10% of your eggs, once they're thawed and they survive, once you inject them to fertilize them, there's no difference in the quality. So once they actually survive that process, they're fine. There's no difference in the outcome.
Okay. Thank you so much, Suvir. This has been absolutely fascinating. And, you know, if people want to find out more, you can either contact Harley Street Fertility Clinic directly or come through me. I'm more than happy to help. And also, as I mentioned, you've just written a brilliant article on the Fertility Help Hub website. So please do head to the link in bio to read that too. So yeah, I mean, what would you suggest for people who are kind of looking into it? Should they come into a consult? Do they drop you a line?
No, it's an excellent way to round it off, really. The first step is to give us a call to find out a bit more. We can tell you about what the actual sort of specific criteria are, and definitely do some reading online. Like you said, we wrote a recent article about this that explains the process. And for those of you who do know about it but have friends who aren't sort of sure, I always say spread the word, because you're right, not a lot of people know about this option. The number of people who say, oh, I didn't know that could work. And they're, you know, from both sides, whether it's the donation side or the receiving side, people are surprised to learn about this. I say we should really get people better informed. So please do pass it on to friends, family, whoever might be trying. But give us a call and we can definitely help you through the process one step at a time.
Fantastic. Thank you so much. And thank you to everyone for joining tonight. Sorry about the issues at the beginning.
Thank you again, Eloise. And thank you everyone for listening.
Bye-bye. Bye.